What happens if the patient's taking the tablets, they've taken the maximum dose, and it's still not enough? It still doesn't work. What are the next steps?
I'd like to take us back to square one, really, and say that before you start on any treatment, I said that there's always a cause for the erectile dysfunction. So I think any patient, before they start on the treatment journey, should have some blood tests to exclude raised cholesterol, high blood pressure, type 2 diabetes, prostate problems in the first place, so that they can be addressed at the same time. Unfortunately, in the real world, patients have usually tried a tablet that they've got from somewhere, a doctor who didn't take a proper history, or a friend. These things happen. And so therefore, they don't work. And that's the time when you must do the investigations to try to find out if there's a medical reason why they didn't work. And you then address that medical reason. The commonest reason that they don't work is because the patient has a low testosterone level.
Right.
Because you need a certain amount of testosterone in your body to upregulate the effect of these drugs. And they have been shown time and time again not to work as well in men with low testosterone. And that particularly occurs in men with type 2 diabetes.
I think that brings us very nicely to our next question, testosterone. So out of the cases of erectile dysfunction, what percentage do you think are actually tied to testosterone or low testosterone levels?
Well, the important thing to realize is that there's no such thing as a male menopause. If ever you see that written in a journal, it's a total myth. Women have a menopause, which occurs from about age 52, 53, and can last for 10 years or so. Men don't have a menopause. What happens with men is that the testosterone levels tend to fall from about the age of 30 onwards in a gradual fashion. But some men will lose testosterone at a faster rate than others, so that they will run into a problem that's worse than just normal aging. And that's round about 25% of men who will have inappropriately low levels of testosterone for their age. And that usually presents with three common symptoms. One will be loss of libido or sexual desire, less interested in sex, less interested in initiating sex. Loss of morning erections, that one's cropping up again, and erectile dysfunction. Those three things are the best predictors of a low testosterone, and failure to respond to one of the tablets that should normally work will be the other. And so we must measure the level of testosterone if that happens.
25%, that's huge. It's a huge amount of men that are having low testosterone.
Yes, but we've got to realize that as some of these men might be older, they might have stopped having sex, because if they're getting older, their partner's getting older, it's not essential. The rate of sexual activity can fall off and be perfectly normal for that relationship. So that doesn't mean they all need treatment.
And do you think that we're treating enough of these men that are having low testosterone, or is that something that we need to be looking at identifying and treating more, especially in the UK?
We certainly should be diagnosing it, because several studies have shown there's a very close link between low testosterone and type 2 diabetes. They go together very closely. So if you have low testosterone, you have twice to 3 times the risk of developing type 2 diabetes. And you'll also be overweight, because if you think about testosterone and what it does, it's involved with muscle. If we think about someone who might be taking testosterone, you think of somebody who might be more muscular. So therefore, when your testosterone level falls, you have more fat and less muscle. And that's not good for anybody, because that fat is metabolically active, and that's what causes type 2 diabetes. So surprise, surprise, if you replace the testosterone, you prevent type 2 diabetes. So that's why it's critically important.
So what would be your advice to someone that's seeing less morning erections, having problems with erectile dysfunction, potentially suspecting that it might be testosterone? What's the first step for those people?
I must say, go and see your doctor and tell him about it, because if you present him with that story, then he's failing in his job if he doesn't recognize with those critical symptoms that he should be doing blood tests. And this is actually the earliest way that we pick up type 2 diabetes. The most common presenting symptom of type 2 diabetes is loss of morning erections and erectile dysfunction, but only if you think about it in the first place.